Hello and welcome to my Chief Exec's message for January. I'm sure a lot of you will have seen in the media over the last few weeks the massive demand that there is on the NHS and the pressures that we're facing. So these demands are across the entire system, and we have also had a high level of demand, but I'm really pleased to say that particularly in our acute wards that we've managed to make sure that no patients are sent out of area, and we've managed with the demand that we've had. A lot of this has been due to the fact that we've opened up the new Lotus assessment suite, which is designed to enable people to come in for an assessment, a short-term assessment, and this new service has been really successful in making sure that people don't get admitted where they don't need to be. So over 75% of the patients that they've seen have been discharged back to home with community support and may previously have been admitted. So it's very early days still in terms of the operation of this unit, and we'll do a full review of this in February and March. So of course it wasn't just the psychiatric decision unit that has helped to manage demand and provide an excellent service to our patients. This is of course a big thanks to everyone who's working on wards and in our community services and crisis services, who've really worked hard to cope with this extra demand over the recent months. A couple of changes that I need to update you on board posts. So some of you will have heard by now that our current medical director, Dr. Witcher, has got a new post as the regional medical director for NHS Improvement. This is fantastic news for Emma, and I think a testimony to the hard work that she's done over the last few years at South West London and St George's. Emma's played a key role in helping to us improve services across the trust, and she will be missed here. So I wish Emma all the best for the future and good luck in her new role. I've asked Dr. Mark Potter to act up into medical director, and Mark has accepted this. Mark will start in February when Emma joins the NHS Improvement, and we will be recruiting to a substantive post for the medical director. Another change, we will have a new finance director. I'm delighted to announce that Philip Murray will be joining us as our new finance director. Philip is currently the Chief Financial Officer at Aylesbury Vale CCG, and Philip will join the Trust at the beginning of March. He's got a wide range of experience of the NHS, both in providers and in commissioners, so I'm really looking forward to working with Philip over the next few years. So I've spoken before about the development of new services as part of our acute care pathway and looking at how can we make alternatives to admission. So I'm really pleased to announce that 2 new crisis cafes will be opening in April of this year, and these cafes will provide an accessible and normal kind of cafe-like environment in South West London, operating in the evenings and weekends, where people who have got a mental health problem, feel that they're in a mental health crisis, can attend and get peer support and advice. And this really is kind of an alternative to go into A&E departments, but also just general help for people. The cafes will, so as I say, operate like normal cafes, provide hot and cold drinks and snacks and a range of activities that can really support people and help to alleviate their crises. There's going to be 2 cafes, one will be in Tooting and one will be in West Wimbledon. Both have really good transport links across South West London, and we'll give you more news about those as the opening gets closer.